Hi, this is Elliot Fishman. I'm live. We always have some problem getting started with YouTube, but we're here, we're live, and we're well. Hope everyone is doing well. It's the 23rd of March. Nice weather outside, not hot, not cold, kind of dry. Baltimore's kind of not the snow, not the rain, so we're doing pretty good. And as most of you know, March is colon cancer month. So I thought I'd speak a little bit about colon cancer and the impact of radiology. Way back when in the old days, we'd do barium enemas to look for colon cancer. So which meant pick up some small polyps, a lot of big cancers. Colonoscopy came along, optic colonoscopy, which is still the gold standard. One of the things, of course, is there are complications, perforation, bleeding, even get splenic injury, but that's pretty rare. You need anesthesia, which can be a challenge for some people, but for most people, the biggest pain in the neck about real colonoscopy is the prep. You need to have prep, go lightly, which is anything but go lightly, or other preps, but you need to do it every 5 to 10 years, depending on your status and your risk factors. Now, one of the challenges with colonoscopy, even with the best colonoscopists, accuracy is in the 80-ish% range, which means you can miss small polyps, which is critical. This week, it was announced at the NVIDIA meeting when Jensen Huang was giving his State of the AI address that there's a program from Medtronic which uses AI for improving the accuracy for colonoscopists in real time to detect polyps. I think it's called Genius AI, not a very novel name, but it's colonoscopy. It's a nice blue box. You can read about it online and know what it does exactly, but it helps the colonoscopist not miss polyps. Also, we'll analyze them to say what are high-risk polyps. So it's just kind of brilliant because it's one thing if someone looks at your colonoscopy after it's done with AI and says, oh, you missed 3 things, you got to go back. That's not good. You got to re-prep the patient, sedation. This is real time. You don't miss anything. Just fantastic. It's FDA approved, so it has met certain criteria. It's now available at the VA. And I'm sure there are other companies coming along with things very much like that. But the little bit I've looked at, Medtronic is the head of the game. But again, AI is everywhere. Now you have AI real time looking at colonoscopy to detect colon polyps. Impressive. We do virtual colonoscopy on patients with failed colonoscopies, patients who refuse colonoscopy, patients who have risk factors. Vert colons are okay. The key is the prep. Software has gotten better. Most people don't like doing them because they don't pay very well. Reimbursement's sort of crummy. And it takes a long time to do a study, even with lots of experience. We don't do all that many, so you don't get lots of experience. The ACR now has opened their training site in Virginia. But again, it's expensive, time consuming, and people aren't that keen on doing it. The techs aren't that keen on studying the patient with CO2, doing prone, doing supine. Yes, it's less painful than colonoscopy, but the prep's the same. And with colonoscopy, hey, you get a good snooze. So for the right patient, it's good. And I won't go through that in detail. And the results are good when you look at the literature. But you have to be careful that unless you're someone like Perry Pickard, a lot of experience doing a lot of cases, you may not be that good if you're doing a case a week, which is the typical thing in most places. So again, vert colon, opportunity. Where I think a lot of the opportunity also comes in for surely early detection with colon cancer will be liquid biopsy. Liquid biopsies, whether it's Exact Sciences or it's Grail, looking at early detection on blood tests for cancer. They're getting more specific to try to localize, including colon cancer. So the question is, will you get a physical exam every year and you get the blood test? And will that be enough? And only if the blood test is positive, you get colonoscopy. We shall see how that works. In the short term, surely, even if these liquid biopsies are approved by the FDA, it's not going to be instead of another study. So they're still going to say, do mammography, do colonoscopy, do whatever it is you're doing. This will be like an added layer. Another thing that's available now is Cologuard. That's a DNA test for looking at stool samples looking for the presence of cancer. They're looking for DNA markers. High accuracy, false positives, false negatives. A lot of people who are a little bit scared of doing colonoscopy get the study done. If it's positive, then you'll go to colonoscopy and you'll have a higher chance of someone finding something. If the Cologuard is negative, the chance of having a tumor is indeed very small. So again, there's a lot of work going into the whole area of colon cancer. There's work on new chemotherapy agents. There was some work published this year. You may have read about it in the paper at Sloan Kettering. Some patients with unresectable colon cancer were put on this new chemotherapy. And the colon cancer, the goal was to shrink the tumor and hope the patient could get surgery. Well, it shrunk the tumor to the point that you couldn't find the tumor. There was no tumor left, even on biopsy. And so they did not operate on the patient. Now, we're going to follow those patients, see what happens to them. But it does make the point that perhaps chemotherapy will be the cure. You won't even need surgery. Right now, it's surgery. Hopefully, you pick it up early. You do a polypectomy. A little more, you do a side-to-side anastomosis and the like. Again, colon cancer, we do lots of colon cancer in our practice, CT and PET-CT, looking for mets, local spread of disease, nodes, liver mets. Again, key, get colonoscopy, try to avoid getting the tumor, but lots of work is going on and lots of changes are taking place. So I think that indeed is exciting. I think these different months, pancreas, I think it's October, colon, breast, again, makes us think about a lot of the things we need to do as radiologists to get better at detection and management, and also to look beyond radiology to see what's happening in other fields. The excitement where AI is touching everything. Colonoscopy is one good example. AI for better detection of colon cancer on CT or on vert colon, that will be coming along. Lots of things are changing. New chemotherapies, some designed by AI. AI is everything. I'll stop there and hope this helps you a little bit. Lots of things to read about. I recommend you go look at that thing from Medtronics. You're not going to be using it. You're a radiologist, not a colonoscopist, not a GI doc. But it does show a lot of what we can do. And think about that in terms of radiology and real-time AI helping manage what we do. I think that indeed is very exciting. And with that, I wish you a great day, and I'll see you next time. Be good, everybody.